41. Which of the following should be monitored regularly in an asthma patient receiving long-term corticosteroid therapy? A. Blood glucose levels. B. Blood pressure. C. Liver function. D. Hemoglobin levels. Answer: A. Blood glucose levels. Rationale: corticosteroids can cause elevated blood glucose levels, especially in long-term use. Blood pressure, B. Liver function, C. And hemoglobin levels, D. are not typically affected by corticosteroids. 42. Which statement is true regarding the peak flow meter in asthma management? A. It is used to measure oxygen levels in the blood. B. It helps assess the level of bronchoconstriction in the lungs. C. It is used only during acute exacerbations. D. It measures the amount of mucus in the airways. Answer: B. It helps assess the level of bronchoconstriction in the lungs. Rationale: the peak flow meter measures how fast air can be exhaled, which helps assess the degree of bronchoconstriction. It does not measure oxygen levels, A. Mucus, D. or is limited to exacerbations, C. 43. Which of the following is a symptom of a life-threatening asthma attack? A. Increased wheezing. B. A sudden reduction in wheezing. C. Coughing that improves with rest. D. Mild dyspnea that improves with medication. Answer: B. A sudden reduction in wheezing. Rationale: a sudden reduction in wheezing indicates severe airflow limitation and a life-threatening attack. Increased wheezing, A. is a common symptom but not life-threatening. Coughing that improves, C. or mild dyspnea, D. are not signs of an immediate life-threatening issue. 44. How should a nurse respond to a patient using a corticosteroid inhaler for the first time? A. Explain that the medication works immediately for symptom relief. B. Teach the patient to rinse their mouth after using the inhaler. C. Advise the patient to use it only during exacerbations. D. Inform the patient to expect rapid weight gain. Answer: B. Teach the patient to rinse their mouth after using the inhaler. Rationale: rinsing the mouth after using corticosteroids helps prevent oral thrush. The medication does not work immediately. A. Should not be used only during exacerbations. C. And does not cause rapid weight gain. D. 45. What should a nurse do if an asthma patient's peak flow measurement falls into the yellow zone? A. Immediately administer a bronchodilator and call for emergency help. B. Ask the patient to rest and monitor for symptoms. C. Administer a SABA and recheck peak flow after 20 minutes. D. Do nothing until symptoms worsen. Answer: C. Administer a SABA and recheck peak flow after 20 minutes. Rationale: a yellow zone indicates moderate bronchoconstriction, so the patient should receive a bronchodilator, SABA, and recheck the peak flow to monitor for improvement. Immediate emergency care, A, is not necessary unless the condition worsens. 46. What is the correct action for a nurse if an asthma patient experiences a severe attack and does not improve after using their inhaler? A. Call for emergency assistance immediately. B. Administer oral corticosteroids and wait 30 minutes. C. Continue giving additional doses of the inhaler every 10 minutes. D. Advise the patient to rest and wait for symptoms to improve. Answer: A. Call for emergency assistance immediately. Rationale: if a severe asthma attack does not improve after inhaler use, immediate emergency assistance is needed. Repeated doses of the inhaler, C, can cause side effects, and oral corticosteroids, B, may not work fast enough. Resting, D, is not appropriate in a severe attack. 47. A patient is experiencing a severe asthma exacerbation and is not responding to a short-acting beta agonist, SABA. What is the next step? A. Increase the dose of the SABA. B. Administer an inhaled corticosteroid. C. Start oxygen therapy and administer systemic corticosteroids. D. Wait for 30 minutes and reassess. Answer: C. Start oxygen therapy and administer systemic corticosteroids. Rationale: if a SABA is not effective, systemic corticosteroids and oxygen therapy are needed to reduce inflammation and improve oxygenation. Waiting, D, can be dangerous. 48. Which of the following is a common side effect of long-term inhaled corticosteroid use? A. Increased appetite. B. Oral thrush. C. High blood pressure. D. Kidney damage. Answer: B. Oral thrush. Rationale: inhaled corticosteroids can cause oral thrush, a fungal infection in the mouth, if the mouth is not rinsed after use. Increased appetite, A. High blood pressure, C. And kidney damage, D. Are not typical side effects of inhaled corticosteroids. 49. Which breathing technique can help control asthma symptoms? A. Pursed lip breathing. B. Shallow breathing. C. Holding the breath for 60 seconds. D. Rapid breathing. Answer: A. Pursed lip breathing. Rationale: pursed lip breathing helps control breathing, keeps airways open longer, and reduces shortness of breath. Rapid breathing, D, and shallow breathing, B, can worsen symptoms. 50. Which of the following environmental factors is most likely to trigger asthma symptoms? A. High humidity. B. Dry air. C. Exposure to smoke and allergens. D. Cold water intake. Answer: C. Exposure to smoke and allergens. Rationale: smoke and allergens are major asthma triggers. Humidity, A, and dry air, B, can affect asthma but are less significant than allergens. Cold water intake, D, does not typically trigger asthma. 51. A patient with asthma is prescribed Montelycast. What is the primary function of this medication? A. To act as a quick-relief bronchodilator. B. To reduce airway inflammation by blocking leukotrienes. C. To thin mucus secretions. D. To prevent bacterial infections. Answer: B. To reduce airway inflammation by blocking leukotrienes. Rationale: Montelycast is a leukotriene receptor antagonist that helps reduce inflammation and prevent asthma symptoms. It is not a bronchodilator, A, does not thin mucus, C, and does not prevent infections, D. 52. What is the primary cause of airway obstruction in asthma? A. Bacterial infection. B. Inflammation and bronchoconstriction. C. Collapse of lung tissue. D. Fluid accumulation in the lungs. Answer: B. Inflammation and bronchoconstriction. Rationale: asthma involves inflammation and bronchoconstriction, which narrow the airways. Bacterial infections, A, may trigger exacerbations, but are not the primary cause. 53. Which food should a person with asthma avoid if they have a sulfite sensitivity? A. Fresh fruits. B. Dried fruits. C. Whole grains. D. Fresh vegetables. Answer: B. Dried fruits. Rationale: sulfites, which can trigger asthma in sensitive individuals, are found in dried fruits, processed foods, and some wines. Fresh fruits, A, and vegetables, D, are generally safe. 54. Which statement is true about exercise-induced asthma? A. It is triggered by pollen exposure only. B. Symptoms typically appear after stopping exercise. C. People with asthma should avoid all exercise. D. It can only be treated with oxygen therapy. Answer: B. Symptoms typically appear after stopping exercise. Rationale: exercise-induced asthma symptoms often appear after stopping exercise rather than during. Pollen exposure, A, can contribute but is not the sole cause. Exercise, C, is encouraged with proper management. 55. A patient with asthma reports frequent nighttime symptoms. What does this indicate? A. Well-controlled asthma. B. Poorly controlled asthma. C. A normal variation of asthma. D. A response to cold air. Answer: B. Poorly controlled asthma. Rationale: frequent nighttime asthma symptoms are a sign of poor control and may require adjustments to treatment. 56. Which type of medication is preferred for long-term asthma control? A. Short-acting beta agonists, SABAs. B. Long-acting beta agonists, LABAs, combined with corticosteroids. C. Antihistamines. D. Decongestants. Answer: B. Long-acting beta agonists, LABAs, combined with corticosteroids. Rationale: LABAs plus corticosteroids help maintain long-term asthma control. SABAs, A, are for quick relief, and antihistamines, C, and decongestants, D, do not directly control asthma. 57. A peak flow reading in the red zone indicates what? A, good asthma control. B, mild asthma symptoms. C, a medical emergency. D, the need for an antibiotic. Answer, C, a medical emergency. Rationale: a red zone peak flow reading indicates severe airway narrowing and requires immediate medical attention. 58. What is the best way to prevent exercise-induced asthma? A, avoid exercise completely. B, use a bronchodilator before exercising. C, drink cold water before exercise. D, only exercise in warm temperatures. Answer, B, use a bronchodilator before exercising. Rationale: using a bronchodilator, SABA, before exercise can prevent asthma symptoms. Avoiding exercise, A, is not necessary. 59. Which action should a nurse take first if a patient with asthma is wheezing and has labored breathing? A, assess the patient's oxygen saturation. B, administer a bronchodilator. C, call the doctor immediately. D, ask the patient to lie flat. Answer, B, administer a bronchodilator. Rationale: bronchodilators help relieve wheezing and labored breathing. Oxygen assessment, A, follows, and lying flat, D, can worsen symptoms. 60. Which of the following is a common asthma trigger? A, dust mites. B, drinking milk. C, high-fat diet. D, low humidity. Answer, A, dust mites. Rationale: dust mites are a common allergen that triggers asthma. Milk, B, and diet, C, are not typical asthma triggers. 61. Which part of the respiratory system is most affected by asthma? A, alveoli. B, bronchi and bronchioles. C, trachea. D, larynx. Answer, B, bronchi and bronchioles. Rationale: asthma primarily affects the bronchi and bronchioles, causing inflammation and constriction of the airways. The alveoli are more affected in diseases like emphysema. 62. Which of the following is not a symptom of an asthma attack? A, coughing. B, shortness of breath. C, high fever. D, wheezing. Answer, C, high fever. Rationale: asthma attacks do not typically cause fever. Fever is more likely to be associated with infections like pneumonia. 63. What is the main function of beta-2 agonists in asthma treatment? A, reduce inflammation. B, relax the airway muscles. C, increase mucus production. D, decrease lung function. Answer, B, relax the airway muscles. Rationale: beta-2 agonists like albuterol relax airway muscles, making breathing easier. They do not reduce inflammation, A, directly. 64. Which medication is used as a rescue inhaler during an asthma attack? A, Montelukast. B, salbutamol, albuterol. C, inhaled corticosteroids. D, antihistamines. Answer, B, salbutamol, albuterol. Rationale: salbutamol, albuterol, is a short-acting beta agonist, SABA, that quickly opens airways during an asthma attack. Montelukast, A, is for long-term prevention. 65. Which test is commonly used to diagnose asthma? A, MRI scan. B, spirometry. C, X-ray. D, ECG. Answer, B, spirometry. Rationale: spirometry measures lung function and airflow limitation, making it a key test for diagnosing asthma. 66. Which of the following lifestyle changes can help manage asthma? A, avoiding known triggers. B, drinking more caffeine. C, reducing salt intake. D, sleeping less. Answer, A, avoiding known triggers. Rationale: identifying and avoiding triggers like smoke, pollen, and dust is essential for asthma management. Caffeine, B, and salt intake, C, do not directly affect asthma. 67. Which of the following is a long-term asthma control medication? A, inhaled corticosteroids. B. Short-acting beta agonists. C. Antihistamines. D. Decongestants. Answer: A. Inhaled corticosteroids. Rationale: inhaled corticosteroids help prevent asthma symptoms by reducing airway inflammation over time. Short-acting beta agonists, B, are for quick relief. 68. Why is it important to rinse the mouth after using an inhaled corticosteroid? A. To prevent tooth decay. B. To prevent oral thrush. C. To help the medication absorb better. D. To avoid a sore throat. Answer: B. To prevent oral thrush. Rationale: inhaled corticosteroids can cause oral thrush, a fungal infection, if residue is left in the mouth. 69. What is a common trigger of nighttime asthma symptoms? A. Exposure to pollen. B. Cold air. C. Sleeping position. D. All of the above. Answer: D. All of the above. Rationale: pollen exposure, cold air, and sleeping position can all worsen asthma symptoms at night, leading to nocturnal asthma. 70. How can a peak flow meter help someone with asthma? A. By measuring lung function changes. B. By diagnosing asthma. C. By increasing lung capacity. D. By delivering medication. Answer: A. By measuring lung function changes. Rationale: a peak flow meter helps track changes in airflow and detect early signs of worsening asthma. It does not deliver medication. D. 71. What should a patient do if their peak flow reading is in the red zone? A. Take their quick relief medication and seek medical help. B. Continue normal activities. C. Drink water and wait. D. Exercise to improve airflow. Answer: A. Take their quick relief medication and seek medical help. Rationale: a red zone reading indicates severe airway narrowing and requires immediate action. 72. Which of the following is a sign of poorly controlled asthma? A. Using a rescue inhaler more than twice a week. B. Sleeping well every night. C. No coughing or wheezing. D. Normal peak flow readings. Answer: A. Using a rescue inhaler more than twice a week. Rationale: frequent use of a rescue inhaler suggests poor asthma control and the need for treatment adjustments. 73. Which weather condition can worsen asthma symptoms? A. Cold and dry air. B. Warm and humid air. C. Hot and dry air. D. All of the above. Answer: D. All of the above. Rationale: different people have different weather sensitivities, and cold, dry, or humid air can all trigger asthma symptoms. 74. What is the purpose of a spacer with an inhaler? A. To make the inhaler easier to hold. B. To increase medication delivery to the lungs. C. To filter out harmful substances. D. To make inhalation slower. Answer: B. To increase medication delivery to the lungs. Rationale: a spacer helps deliver more medication into the lungs instead of it being lost in the mouth or throat. 75. Which of the following allergens is commonly associated with asthma? A. Pollen. B. Pet dander. C. Dust mites. D. All of the above. Answer: D. All of the above. Rationale: pollen, pet dander, and dust mites are all common asthma triggers. 76. What should be included in an asthma action plan? A. A list of asthma triggers. B. Steps to take during an asthma attack. C. Medications and dosages. D. All of the above. Answer: D. All of the above. Rationale: an asthma action plan includes triggers, medication information, and emergency steps for better management. 77. What should be the first action if someone is having a severe asthma attack? A. Call emergency services. B. Give them a glass of water. C. Ask them to hold their breath. D. Tell them to relax and wait. Answer: A. Call emergency services. Rationale: in a severe asthma attack, immediate medical help is needed, along with the use of a rescue inhaler. 78. How often should a person with well-controlled asthma experience symptoms? A. Every day. B. Once a week or less. C. 3 times a week. D. Every night. Answer. B. Once a week or less. Rationale. Well-controlled asthma means having symptoms less than once per week and no frequent nighttime symptoms. 79. Which household item is most likely to trigger asthma symptoms? A. Feather pillows. B. Cotton sheets. C. Wooden furniture. D. Metal doorknobs. Answer. A. Feather pillows. Rationale. Feather pillows can trap dust mites and allergens, making them a potential asthma trigger. 80. Why is smoking harmful to people with asthma? A. It strengthens the lungs. B. It reduces airway inflammation. C. It increases airway irritation and mucus production. D. It has no effect on asthma. Answer. C. It increases airway irritation and mucus production. Rationale. Smoking worsens asthma by increasing airway inflammation and mucus, leading to more frequent and severe attacks.